Alarming alerts from experts highlight a significant global healthcare risk associated with COVID-19, suggesting the potential onset of a pandemic of heart failure. A recent study conducted by Japanese scientists emphasizes the growing concern over COVID-19 cases, particularly attributed to the emerging JN.1 strain and its potential to contribute to heart-related complications. As COVID cases surge in multiple countries, including the US, UK, China, and India, a recent spike linked to the new JN.1 strain has raised concerns among health experts. A warning issued by scientists at Japan's prestigious research institute, RIKEN, emphasizes the heightened likelihood of potential heart issues for individuals contracting the disease. According to the report, the coronavirus attaches to ACE2 receptors prevalent in the human heart cells, leading to a potential impact on cardiac function. While the exact reason remains unclear, the report speculates that the dynamics of the COVID pandemic might be a contributing factor. The report cautions that the persistent infection of SARS-CoV-2 could exponentially increase the number of individuals at risk of future heart failure. The report states, even though conclusive clinical evidence that persistent SARS-CoV-2 infection is associated with declined cardiac function has not been reported so far, the proof of concept study of the possibility of SARS-CoV-2 persistent infection of the heart and the potential risk of opportunistic progression of heart failure should be validated by a three-dimensional human cardiac tissue model, which would serve as the alarm bell for a global healthcare risk. Amid a notable surge in COVID cases across various continents, particularly the US, the latest cautionary note arrives as millions gear up for the holiday season travel. The rapidly spreading JN.1 variant now constitutes 44% of all cases nationwide, posing an elevated risk. Health officials emphasize the potential for a substantial uptick in illness cases this winter, fueled not only by the increased prevalence of COVID, but also a growing number of flu cases. This concern is particularly pronounced ahead of crowded social events associated with New Year's celebrations.
Subscribe to One India channel and never miss an update.